Is immunotherapy more about survival or about living with dignity?
It's both. So basically, it not only ensures longer survival, also it ensures a good quality of life, which is what we are looking in a very advanced kind of malignancy.
Can immunotherapy continue working even after treatment stops?
Depends on person to person. In some patients, it will last for quite a few months, and in some patients, it will last beyond a year also.
Why are some patients calling immunotherapy a second chance at life?
So definitely, it's like a new life for a patient.
Hey everyone, I'm Aishwarya. We are joined today by Dr. Vijith Shetty, a renowned medical oncologist, professor and head of the oncology department at K.S. Hegde Medical Academy. He's here to talk about one of the biggest breakthroughs in cancer cure, immunotherapy. Welcome, sir. So as you know, cancer treatment is changing rapidly, and these days patients are hearing a term called immunotherapy. So can you tell us more about it?
That's right. So actually, we have a lot of queries from patients asking us what is cancer immunotherapy. So immunotherapy makes the body's immune system work against the cancer. Unlike traditional chemotherapy, you must have heard about targeted therapy.
Yes.
All these medicines kind of act directly on the cancer. This kind of indirectly works on the cancer cell by stimulating the body's immune cells. These in turn go and destroy the cancer. So that way it's very safe for the cancer patient to take this treatment, and does not have all the side effects of traditional treatment like chemotherapy or targeted therapy. It has its own fair share of side effect, but that's very, very rare.
Can you just tell us about a few of them?
Sure. So immunotherapy does come with some side effects as well. It can destroy the normal cells. So what happens is sometimes the immune system goes into a hyperdrive and it destroys the normal cell, mistaking it for a cancer cell. So this is why someone gets immune mediated side effects. Now that is very rare. Even if it happens, we grade these side effects into grade 1, 2, 3 and 4. So generally the side effects are grade 1 and 2. If it goes to grade 3 or 4, we generally stop the immunotherapy, and the chance of that happening is less than 5%.
So as we know, in chemotherapy we have hair loss and the other things. So
Right.
in immunotherapy, what are the visible changes that one can notice?
So one very common side effect of immunotherapy is fatigue. So patient will have unreasonable fatigue. Also, they will complain of itching. Some very few patients have off-target effects of immunotherapy. So they get itching because of immunotherapy. So this is another side effect. Depends on the site of malignancy the patient has and the type of drug we are using. So some drugs have specific side effects. Some can have diarrhea. Some can have rash, skin rash. These are all very rare side effects. Again, I want to reiterate, it's a very rare side effect. But another common side effect what we see is endocrinopathy. That is, some patient can develop hypothyroidism on treatment. When that happens, we start them on simple oral tablets to control their thyroid. So these are all some rare side effects of immunotherapy, which can be easily managed by simple medications.
So you're saying in comparison to chemotherapy, I think immunotherapy has lesser side effects.
I wouldn't say that exactly. Reason being, immunotherapy can cause fatal side effects as well. But having said that, when you ask the question compared to chemotherapy, definitely the side effect is much lesser. But if we do get some very rare fatal reactions, but that is very, very rare, like I said earlier.
Is immunotherapy changing cancer from a deadly disease into a long-term manageable condition?
That's right. Actually, immunotherapy has been a game changer. Before immunotherapy, we used to lose patients. I'm talking about stage 4 patients. To the underlying disease. Now, with the advent of immunotherapy, we are seeing many patients going into very long, what we call in our jargon, durable remissions, which means it has become from a deadly disease to a chronic manageable condition. So many patients live for, you must have heard, some patients living with cancer for beyond 5 years. These things were unheard of in the past. With the traditional chemo and targeted therapy, at best we could achieve 2 to 3 years. Now we are seeing patients live beyond 5 years. There are so many people in the mainstream media who know about so many celebrities who have this underlying condition. So there are so many in our known relatives, who are doing well, circle who are doing very well. So yeah, definitely it's a game changer and has made a deadly disease into a chronic manageable condition.
Why are some patients calling immunotherapy a second chance at life?
So definitely it's like a new life for a patient. So someone who has been diagnosed with a stage 4 cancer, the writing is already on the wall. So with somebody, the percentage again is 30 to 40% of the patients. So in 30 to 40% of the patients, even with stage 4 cancers, they are going to complete response.
Okay.
And this was never unheard of kind of a scenario. That's why people are telling it's a second chance at life. So immunotherapy has done that, and as we speak, there are so many advances happening. They are refining the immunotherapy as well. So I'm sure in the next couple of years, we'll get many more molecules, and we are just prolonging the graph further and further. So earlier timeline was 4 years, now it's 5 years, now it's in few years we'll start hearing patients living beyond 10, 12, 20 years, and not just living, they will be doing all the day-to-day activities and having a very good quality of life. So that is something which was not there with the older treatment modalities.
Okay. So also, is there a particular age bracket to which this treatment is prescribed?
Yes, generally we tend to give immunotherapy beyond a certain age. So after 18 years is generally the time point where we initiate somebody on immunotherapy.
Okay.
Having said that, they are conducting pediatric trials, but as of now, it's not in use for mainstream.
Okay.
Only in experimental setting or in clinical trial setting we are using it. But outside the purview of clinical trial, we are not really pushing immunotherapy in the pediatric population.
Okay.
So in the adults, adolescents, young adults, and in adults, we are using immunotherapy.
So the 18 is the age, I mean, approximately.
We have given, having said that, we have given it in patients who are 16 years old as well.
Okay.
So the 18 year is the time frame they use for conducting clinical trial, because someone has to give a consent. Now, when the parents give a consent in a 16-year-old who has no other options left, we have given immuno in such patients and got complete response. So which was something which was unheard of before.
Okay. What about the treatments for children, sir? I mean, if they...
in children, generally pediatric malignancies are very curable malignancies. So they generally tend to do well with chemotherapy alone.
Okay.
Again, we are using a lot of newer molecules like ADCCs. They are not immunotherapy exactly.
Okay.
They are antibody drug conjugates. They specifically target the malignant cells. So there we use a different class of drug, which in common jargon we tell a patient as immunotherapy. They are not exactly immunotherapy, but they work something similar to immunotherapy. But they are not exactly immunotherapy. They are more like targeted therapy with an attitude.
Oh, okay.
Yeah.
Can immunotherapy continue working even after treatment stops?
Yeah, that's a very important and relevant question. Many a times patients feel after a finite time, generally we tend to give immunotherapy for 2 years or 3 years at max, depending on again which molecule we are using. So the effect lasts even beyond stoppage of the therapy. So once the immune system, it's like training a child to ride a bicycle. So initially they will not be as, they'll stumble and fall. So with immunotherapy, again, with the subsequent treatment, the immune system gets better and better, and the effect stays on even after stopping the treatment after a certain point in time.
Oh, that's great.
So that it does that. It's called after immunotherapy effect. So it will be there for, in some patients, again, depends on person to person. In some patients, it will last for quite a few months, and some patients it lasts beyond a year also.
So for immunotherapy to act well or to be successful, as in when you give the treatment to the person, so does the lifestyle factors also come into play? I mean, how healthy the person is?
Again, that's a great question, because we do give this immunotherapy even in patients who are very frail. So if they are frail because of the underlying disease, their immunotherapy works like magic.
Okay.
So you need not be extremely fit to undergo immunotherapy. But having said that, in very frail and elderly, the immune system is not very robust. So it cannot really mount a response. So in a young patient who's frail because of the disease, their immunotherapy works well. So there we tend to push. So many times patients come and ask us, the attenders will ask us, he is very frail, I don't think he'll tolerate your treatment. So the answer to that question is they are frail because of the disease. So if it's a young patient who's otherwise frail because of the disease, their immunotherapy works like magic, rather than somebody who's in his 80s, 90s. So when you say
old age, I mean that age bracket.
So again, that bracket is getting pushed every decade, you know. So when we were in training, 60s, 70s was taken as old age. Now we have so age is no longer a criteria. If someone is fit enough to tolerate, we have a geriatric assessment score. So where we do a lot of parameters and see if patient can withstand treatment. So we do a scoring and see whether the patient can tolerate treatment. So if the geriatric score is good, even in 85, 90-year-olds we have given immuno and we have seen fantastic responses.
That's great.
Yeah.
Why do some tumors completely disappear with immunotherapy while others resist it?
So again, that's a very good scientific question actually. So again, tumor is a very heterogeneous kind of it's a different situation. Like it's like, for example, to put things in perspective, in our country, from Jammu and Kashmir to Kanyakumari, there's so much of diversity. Similarly, in a tumor also, there are many areas which are very susceptible to destruction by immunotherapy. There are some areas in which immunotherapy will not work at all.
Okay.
So these areas where it does not work well are the ones where the resistant clones grow.
Okay.
And that's how it starts, it initially shows a response and then doesn't start doing as well. So these are the patients where they have more of resistant clones than a sensitive clone.
Okay.
And someone who has say 90% sensitive clone and less than 10% of resistant clone, there the immunotherapy will work very well.
Okay.
So again, depends on patient to patient. Many a time relatives have a query, patients' relatives have a query that, in one of our relatives it has worked very well, why hasn't it worked well in this patient? So the answer for that question lies in this, that it depends on the tumor type as well.
Okay.
So many a times wrongly the public have a perception that in a particular center the results are better. Again, that's more like a selection bias. So if the patients who have a good disease biology go to that center, they'll obviously have a better outcome.
Got it, sir. Is immunotherapy more about survival or about living with dignity?
It's both. So basically, it not only ensures longer survival, also it ensures a good quality of life, which is what we are looking in a very advanced kind of malignancy. So many a times we come across young women who are afflicted with this dreaded disease, and they are really worried about or concerned about hair fall. Generally, there is one side effect which is not seen with this immunotherapy, but there are times where we have to combine it with chemotherapy, depending again on the tumor profile. So we study the tumor in detail and decide who gets immuno plus chemo or only chemo. So we study the patient's tumor profile and then decide what is best for the patient. So now it is.
I've heard of a term called dual immuno.
Oh, that's fantastic. I think that's a very good question. Again, dual immunotherapy. So now that is a new rage where they're combining two immunotherapy molecules which work in synergism.
Okay.
So one acts at regulating the T cells microenvironment, and the other one increases the tumor T cells.
Okay.
So basically both work together in synergism. Because of that, we do get more immunotherapy related side effects also, but we sometimes get magical responses as well.
Okay.
So again, it is individualized, personalized. Each patient is different, each cancer is different, and each outcome is different. So no one can predict with certainty in the beginning of the treatment whether the patient will do well or not.
So are you saying one who has like underlying diseases, like probably like previous medical history, having diabetes or anything of that sort, so do you think they will be still fit to undergo immunotherapy? Yes.
Yeah, I think there's a lot of myth in the general public regarding comorbid conditions and immunotherapy. So the only real kind of a contraindication for immunotherapy is autoimmune diseases.
Okay.
Say somebody has autoimmune condition like say rheumatoid arthritis or say SLE, or there are so many autoimmune conditions where the body's immune system is dysfunctional. There we do not advocate immunotherapy at all.
Okay.
Or we again case to case basis we decide whether the risk benefit actually plays a major role in decision there. So there are few contraindications for use of immunotherapy as well, which are very clearly defined.
Okay.
So depends on the patient's condition and the underlying comorbids. That's when we decide. So diabetes per se is not a contraindication.
Okay.
Underlying heart disease is also not a contraindication. It's a relative contraindication.
Okay.
If the heart is functioning fine, we of course take our cardiologist's opinion, and if the heart is functioning well and the tumor is very susceptible to immunotherapy, then we discuss with the cardiologist and with the patient and then offer immunotherapy.
Okay. Now coming to the expense, has it been made affordable? I mean, in the current day, do you think it's affordable to the public, or how would you compare it in comparison to chemotherapy?
Great question. So because finally we can discuss all day about immunotherapy, but if somebody cannot take the drug, there's no point having all this discussion. So luckily, thanks to a lot of Indian pharma companies, they have come with the generic version of immunotherapy, which works very well actually. That has increased accessibility to almost 50% now the usage. It used to be less than 10%. 3 to 5% is what was the general usability of immunotherapy. We had to import all the molecules, but now thanks to a lot of Indian pharma companies, we are getting generic version of the same molecules, which are also very effective and it's not that because the cost is 1/10 of the original molecule, it's not that it's not very effective. We use very often these molecules in our day-to-day practice, and they show very good results actually.
So, is the treatment available only in selected centers or hospitals, or is it easily accessible across various centers in the city?
Ideally, this treatment should be done under supervised care by a trained medical oncologist who's been practicing immunotherapy. So, and in terms of accessibility, it's accessible all across the country.
Great.
Even in tier 1, tier 2 cities. My practice is predominantly in a tier 2 city. And we do, we have all the main drugs which is available in the metro cities available in a tier 2 city as well. So patient need not travel all the way to a bigger city just to get the infusion done. The same treatment can be done in their local place as well by a trained medical oncologist.
Are we entering an era where the immune system becomes the main cancer fighter?
So we are not there yet to answer the question on its face. So it's not still ready as a solo monotherapy. We do give it in certain settings. Again, depends on tumor type and the expression of immune signature of the tumor. So in some patients who are elderly and frail, where they have a very high expression of a particular marker, which shows that immunotherapy will work very well as a single agent, we do it. And we have seen complete disappearance of tumor in those patients. So which is something which had never happened in the past. So in an elderly frail, you cannot give chemo, you cannot give targeted therapy because of the risk of side effects. We are able to give treatment to those patients, and they are going into complete response and having a good quality of life. We do have to monitor for treatment related side effects more often in them, but they do tolerate the treatment very well.
That's great news. Could immunotherapy reduce the fear associated with cancer treatment?
It could in a large way. General fear, like I discussed, was the fear of hair fall, vomiting, nausea, fever, because the chemotherapy generally doesn't differentiate between a malignant cell and a normal cell. So the normal cells do take a hit, the WBC count does take a hit. So the patients have a very high chance of developing fever. So that side effect is not seen with immunotherapy at all. So it does mitigate the fear of cancer to a larger extent, the cancer related treatment. So it has kind of changed the world for a lot of patients.
So do you have any one final message to our viewers?
Yeah, so cancer is a dreaded disease, and you have to choose your partner well who will guide you in the treatment of this dreaded disease. There are a lot of treatment options available now. Please don't fall for the myths which you come across in social media. There's a lot of myths in the society. Please don't take opinions from your well-wishers without consulting a qualified medical professional. There are specialists for each field. Kindly consult the concerned specialist of that particular department, and then take your informed decision. Please don't fall for the myths and gimmicks which you come across in social media. I think that is one message for our viewers.
Thank you so much, Doctor, for sharing your valuable insights.
Thank you. Thank you so much. Thanks.
And also helping us understand how immunotherapy is impacting the future of cancer care. And to all of you listening, stay informed, stay hopeful, and stay healthy.